Hello everyone. The Indian Medical Association of Queensland has been running a public health lecture series since March 2020. Our members, who are doctors of Indian origin and practice in this wonderful state of Queensland, they volunteered their valuable time and expertise in this endeavour. The advice given by any doctor is of general nature and meant for information and education only. Please note, this is no substitute for your own healthcare professional, and everyone is advised to consult with their own treating physician for ongoing health issues. I will now ask the Secretary-General of IMA Queensland, Dr. Cyril Fernandez, to introduce to you our guest speaker of this month.
Welcome again to the Ki Shehath program, meaning Your Health, of the Indian Medical Association of Queensland. We have with us Dr. Abba again on part 2 of general practice, highlighting on women's health. Welcome, Dr. Abba.
Thank you, Dr. Cyril.
In continuation of your talk last time, we would like to have imparting the knowledge to the listeners more about women's health. So prior to that, do you want to give us an introduction of general practice women's health again?
Yes.
Start, thank you.
Yes. So a major part of my practice involves looking at women's health condition right from an early age, from girls to as they reach adolescence to early adulthood, and then traversing through the journey of life until.
So what advice would you give if a young girl aged 10 to 19 or in the adolescent, early teenage comes to you?
One of the most important advice I give them is about sun protection. That's the age where they need to be very, very careful with sun exposure. Absolutely avoiding sunburns at all costs. It's important for them to realize that the more episodes of sunburn they have at that younger an age, the higher their risk is to develop skin cancers later in their life. So good slip, slop, slap advice for sun protection.
The skin must have come first, because I understand you have a special interest in skin as well. You do some skin general practice as well.
Yes.
Okay, now let's move on to the women's health part of things, Dr. Abba.
Yes. So the other advice I give to this population, this age group from 10 to 19, is about education about sexual health. It's an important part in their life when they are growing up, when they're exploring life, when they are exploring new relationships. And what's important for them to realize is their safety and also consent, that they can consent to things and they can withdraw their consent. So it's very important for these young women to understand their safety and the concept of consent, especially in the scenario of intimate relationships. And then the other thing is safe sex and sexual health education. So those are the important things I would want them to understand at that age group.
Menstrual periods and things start off.
Yes.
What would you tell them?
Their knowledge about the menstrual cycle and their own bodies is very important at this age and at this stage in their life. So that's another thing. Sometimes they feel very reluctant to talk to their family and to their parents. So a GP's room gives them that safe environment to confidentiality to just be themselves. So a doctor's room provides them that space, the discreet nature of the consultation, the rules around confidentiality. So all of that helps them open up and do the right thing by understanding and developing an insight into what's the right information and gathering that right information.
What special advice or treatment modalities would you apply to young women, adults coming from 20 to 39 years of age?
20 to 39 years of age, again, those same principles apply, apart from having preventive checks, their pap smears, sexual health checks from time to time under the age of 30, looking at their menstrual cycle, any history of PCOS. Those are the things which are important to explore at this stage, particularly managing PCOS, which is polycystic ovarian syndrome. This is a condition where irregular cycles in an imbalance in the hormones can lead to long-term risks around endometrial cancer, which is the cancer of the lining of the uterus. It can affect their heart health, it can cause depression. So the PCOS is an important one to manage in this age group. Again, a woman's fertility issues can be a common one to manage in this age group. Having a reproductive plan, what their reproductive plan is for future, contraception options. Again, women who've completed their family, what are the long-term contraceptive methods for them. So all of these things are very important.
If they are, say, 40 to 59 age group?
So 40 to 59 age group, again, the previous principles for the younger age groups still apply. But what gets added up is breast screening, preferably from the age of 40, and it is government funded from the age of 40. But
so you advise them self-breast examination of any doubt, come to the GP,
yes.
even if there is no symptom,
Yes.
to have some regular checks with the doctor?
Regular breast self-examinations, up-to-date pap smear, preventive lifestyle. That's when a lot of women get very busy with their families, kids, plus the careers. So they find very hard to find time for themselves. So also a screening for mental health issues is very important in that age group.
And in this age group, the perimenopause or menopause starts. So what advice would you give?
So again, perimenopause and menopause is an important time in a woman's life because things are changing in terms of their physical health, their social scenario. Children might have grown up, so their emotional health again may be getting affected. So there's a lot of change again in this age group, and we need to ensure that their physical health and their mental health is on track. So their pap smears, their mammograms, looking at bone mineral density screening, especially if they have risk factors for low bone density, that's very important. Women's preventive health checks are very important in this age group, and that would involve checking their blood pressure, checking their sugars, certain tests to screen for certain medical conditions. Again, checking their BMI, looking at their body weight and what their nutrition is, and of course their mental health as well. So all of these things remain very important.
That's good. So finally, say 60 and above, so we know that a lot of grandmas are staying alone, and so what advice would you give for 60 and above,
So
and age care as well, so briefly?
Yes, so 60 and above, again, we've got to make sure that they have balance and strength. They are doing balance and strength training to prevent falls and preventing fractures in future. Also, again, nutrition is very important, particularly their dietary needs around preventing osteoporosis and managing.
Put them on a plan or something, or look for diabetes and allied health?
Yes, chronic disease management plans are widely used to help manage these chronic health conditions, and it also helps them to continue to visit their GP, who can follow up on medical conditions and check their progress, how they're tracking along in terms of their medical conditions in this time.
That's good, Dr. Abba. As a GP with special interest in women's health and special interest in some areas of preconception as well, and special tests, you have highlighted many different aspects of women's health in general practice for our listeners' health information on this Ki Shehath program. On behalf of the Indian Medical Association, we extend you our gratitude and thankfulness for sharing with us your vast knowledge in this field. Thank you so much.
Thank you, Dr. Cyril, for having me.
And ladies and gentlemen, that has been the Ki Shehath and the part 2 with Dr. Abba, presented by Indian Medical Association of Queensland, and would like to thank Cyril Fernandez for putting it together for us. So that has been the December episode. It can be viewed anytime on the Facebook channels and of course on the YouTube channel as well. So until the next episode, it's goodbye from us.